I know, right? It's a long day. Okay. So hello, everyone. It's nice to be here. My name is Dr. Nicole Tartaglia, and I am a developmental pediatrician at Children's Hospital Colorado and a professor of pediatrics for University of Colorado School of Medicine. My role also in clinic is I'm the director of the Denver Fragile X Clinic. So it's a genetic disorder that's caused by a mutation on the X chromosome that leads to intellectual disabilities and autism and developmental delays, and have worked in the Fragile X field for 20 years. I'm also the director of what's called the Extraordinary Kids Clinic, which is a clinic for kids with all different X and Y chromosome variations. And then also work as a developmental pediatrician in the 22q deletion clinic. And so what I'm trying to say is that I work with a lot of rare genetic disorders, and I'm kind of the person people refer to when there is a question about a medication or medication types of treatments for kids with various genetic disorders. So I will say that I have not worked specifically with any kids who have the conditions that your kids have. And I know from talking to so many families over the years that that's what all the doctors say, and it's so frustrating for families when they hear that. But I will say that if you're from Colorado, I would be happy to see you in our clinic in Denver. And if you're not, I hope you can take something away from this. I think this talk is generic enough that it will apply to everyone, and they're really principles we use in making choices related to medications. So the challenge I'm going to have, though, is that I don't have my slides in front of me, so I'm going to have to look over there to speak through them. So I might want the mic, well, because I didn't put my contacts in. Anyway, we'll see. I've done this talk a lot, so we'll see how it goes. I might just walk over here, maybe. Can I just take this and walk? Okay, that's good. Okay, so I'm going to step from over here. Okay, so the outline for today is that we're going to do an overview of just kind of different conditions treated with medications, kind of the big picture. Then we're going to talk about making decisions about starting medications and kind of what I use as my kind of 5 guiding principles. And then think about starting treatment goals and what kind of things, if you are going to start a medication, what kinds of things to set as treatment goals, monitoring response and side effects. And then we'll talk through a couple of introductions to different kind of medication classes. I want to just do a disclaimer that I'm not going to endorse any specific medication, brand or company. I've received a lot of research funding for different clinical trials and consulting with different pharma companies. None of them that I think are a conflict of interest for this presentation. Any medications, obviously, you need to discuss with your own doctor who knows your child the best. And I can make some general, recommendations, but I'm not going to make any specific recommendations for any specific cases today, because obviously I would need a lot more background to be able to do that. So basically, this is kind of the framework that I use and we use for a lot of rare genetic disorders. And so the idea is that WSS is at the top, and the genetic differences that are caused from WSS lead to differences in brain development that lead to increased risks for many different other neurodevelopmental disorders. On the left-hand side, you can see the list of differences in terms of cognitive and learning differences, all the way from early developmental delays to later learning disabilities or intellectual disability, social developmental difficulties, ranging from just mild social difficulties all the way to some children who meet criteria for autism. And then on the right-hand side, all the different behavioral differences, all the symptoms of ADHD, which can be attentional difficulties, distractibility, hyperactivity, impulsivity, and then other symptoms related to anxiety, especially some separation anxiety, sensory sensitivities, irritability, aggression, self-injury, and then some other behaviors as well. So all of these are things that, you know, we hear about and that the doctors in WSS have talked about in terms of publishing different risks in terms of the behavioral phenotype. And I think they're all things that are important to think about how much they're impacting kids, and then whether or not sometimes what those treatments are, and whether or not that treatment program could benefit from a trial of a medication. So whenever we're developing a treatment plan, you know, medications, well, we're talking about those specifically today, are never alone the answer to anything. And so really they're what I always call a piece of the pie for, of the treatment pie for what we need to do to develop a really comprehensive treatment plan. And for some kids, that piece of the pie doesn't have medications. And for other kids, that piece of the pie is really big and it needs medications. And so the other pieces of the pie are all the other things that you're doing to support them in terms of early intervention therapies or other therapies, the educational supports and things that are happening at school, then other outside, you know, behavior therapies or private therapies that you're doing, the supports that you're providing at home. So all of that is part of the treatment, and then medications are one piece of it, right? That's hopefully complementing those pieces. The other thing is that all of this pie sits on top of this family and home environment, right? And if that family and home environment is nice and stable, the pie can kind of sit there and work. But if you get this really pointy, unstable home environment, then that pie is just going to roll off. It doesn't matter what you're doing with the pie, because it's you guys, right, who need to be stable and be able to be there and provide the best environment that you can. So this is the self-care, take care of yourselves as well, because the stresses of working with kids and having kids who need a lot of extra supports can be a lot. And it's always important to remember that your child also benefits from that little bit of time that you may feel guilty taking for yourself, but your time for yourself also does stabilize that pie for everyone else. Okay, so when should medications be considered? Well, so the biggest thing is that for a lot of these behaviors that we, you know, had listed before, attentional difficulties, you know, distractibility, anxiety, they're all behaviors that all of us have at some point, right? And so the idea is when should you consider it actually something that you might want to treat, or, you know, what is just normal? We all need a little bit of anxiety to get through our days and motivate us and all those things. And so, you know, when is it, you know, something that we need to pathologize or say maybe we need to help with? And the big thing is really when it's causing impairment, right? So you want to just take any of those examples of any of those behaviors and you say, okay, is this behavior, is this challenge causing impairment in day-to-day functioning? And is it enough impairment that, you know, we think that it's leading to restrictions in different areas? And so I always kind of go through my top 5, and we're going to go through these in a little bit more detail, because these are the things that I think are important to think about when we are thinking about medications. And the first one is, you know, is it causing impairment in terms of health and safety overall to self and to others? Is it causing impairments in academics and learning and therapies and the ability to access everything that those are trying to provide? Is it causing impairment in participation in the community? Is it causing impairment in social development or social interactions or opportunities? And then is it causing impairments with self-esteem or really how the individual is feeling about themselves? And so we'll talk a lot more through what these examples and some of these examples might be, but this is kind of what I always go through for the top, for the 5 things I think about when we're considering medications, and what I teach, you know, all our fellows and residents in terms of thinking about also. So before we get to talking about that, there's a lot of common concerns that we hear from parents related to starting medications. And I'm happy to hear from anyone in the audience, but when I bring up a consideration of like, oh, well, we could consider medications for that, I hear a lot of very common concerns from parents. So does anyone know what some of those might be? I'm worried that medication will Yeah, change them. Like, I don't want to change his personality, right? And that's a big thing. We love their personalities. We want to help them, but we don't want to change them make them into a zombie. That's what I hear a lot. And obviously, we don't want to do that either. Yeah, what are the side effects, or would it make it worse? Good. Yeah, side effects and weight gain. That's a big one, right? Especially depending on age and self-esteem and other things. Good. So those are some of them. And then, I don't want my child to become dependent on them or addicted to them. I want them to be able to grow and learn strategies on their own. I don't want them to be drugged or a zombie. I don't want to change their personality. I'm worried that medications might change the way the brain development, develops in the end. And then side effects, will they have to take them for the rest of their lives? And then there's all sorts of other, I read about, I knew a person, and then, bad situations from medication use. And these are all valid concerns, right? And really important concerns to think about. And what I always, really feel is important for families is, if we make a decision as a team, as your doctor and, the parents to start a medication, we all have to be really comfortable that that medication is doing something positive, right? I'm not comfortable prescribing it. You're not comfortable giving it if we can't see that it's making leading to a significant enough benefit that it's, making a positive change. And so if any of these things are true, these side effects are causing so many more problems, like, if you don't feel comfortable giving it because you're not sure or because you think it's changing them in a way that you're not comfortable with, well, then that's not a good medication, and then we need to come up with something else, right? When we're talking about medications for behaviors, it's different than a medication for, seizures or something else, right, where they need it, for sure for, health reasons. For sometimes we need them for health reasons, for if there's a lot of self-injury or really health challenges that are caused by the behavior. But these are ones where there's a little bit less urgency a lot of the times, and a little bit more caution that can be taken to try different things and make sure that it's the right one. And so it's really important that everyone's comfortable with it. Okay, so let's just go through these 5 reasons, and then in a little bit more detail so you know what I'm talking about. I'm going to refer to different behaviors: anxiety, attention, impulsivity, aggression, so you can get a little bit of a idea. So here's the idea of okay, when whatever the behavior and emotional difficulty is causing concerns about health and safety, right? Clearly, if there's aggressive outbursts where they're hurting themselves, hurting other people, that's one big health and safety concern. But there's other health and safety concerns as well. Impulsivity or anxiety that leads to them kind of running off, right, and putting themselves in dangerous situations, jumping off things that are really not safe for them to be climbing on, and those types of things. Sometimes it's not necessarily externalizing behaviors, but more behaviors like, oh, he's just so distracted all the time. He's riding his bike into the middle of the street because he's looking over there, or he's forgetting to turn the stove off when he's cooking. And, so thinking about does attentional difficulties and distractibility, are they causing, safety concerns because the symptoms are coming up so much? And then sometimes there's some health issues from it, right? If they're, very restricted in their eating or very picky about things, that it's causing challenges with growth or weight gain, or causing sleep problems, right? And really, limiting sleep, which can then further impact daytime behaviors. And so, so there's lots of different things to think about from the health and safety perspective that I think are the primary reason to really consider medications. The next one is just the idea that the behavior is causing difficulties in the academic setting. So for sure, for things like attention span, right? How much time is spent redirecting the child to the work at hand versus, them actually working on it. The same thing in therapy. Like if a speech therapist is like, I don't know, I spend, 50% of the time getting him to try and participate in therapy, and then maybe this much time regulating behavior after, like that's not an effective use of therapy time, right? And so if most of the time is spent managing behavior as opposed to interacting and doing the therapy, then, that's another thing, another time to consider. Are they making the progress that they should be in the setting that they're in? And are any behaviors, attention, anxiety, anything else, impacting their ability to be comfortable and as well regulated as they can be in that setting so that they can access what's being given to them, right? In school from the teachers, in therapy, in any other kind of learning setting. Okay, the next one is just thinking about, how much impairment it's causing on the family and the community. There's a lot of times where I'll talk to families and like, oh no, anxiety and irritability isn't bad at all. We're great when we're at home. Okay, well tell me about, what you're doing in the community. Oh, we don't go out. And so that, well, okay, well, what would happen if you do go out? Oh, no, then it's a disaster, right? But don't worry, we're fine. And so just thinking about like really how much is, everyone's life is going to be altered in some way, right? But how much, how narrow or how much less participation in day-to-day types of engagements and in family relationships and all of that is the impairment, is the behavior causing. And so, anxiety can cause a lot of challenges, impulsivity can cause a lot of challenges. So just thinking about, really, what does that look like? And a little bit of, distress about something is not necessarily a reason to cause, to start medications. But, if it's really stuff going on every day or there's big, restrictions in what everyone's doing, then that's something, to think about whether or not something might help. The next one, which I think some people don't always put enough priority is how much it's impacting social relationships, right? Oh yeah, well he's fine at school, she's got an aide and she's hanging out in the classroom, but she's too distracted and distractible and having problems relating with friends, right? If you're not engaged in a social relationship because you're distracted or running off or too impulsive, well then you're not going to be a fun play partner, and then that's going to cycle into challenges with what's going to happen with the building of that relationship. And so those are really important things. Impulsivity really affects social relationship. You're blurting things out you're not supposed to say, or maybe grabbing toys or something else that you're not supposed to be doing. And then it's also really important to think about, kids unfortunately have very long-term memory for kids when they were younger, right? Oh yeah, that's the kid who did this. So everyone gives, a little grace for the first few years, but then after a while, people remember. So you don't want that kind of negative experience of your child's behavior to then carry through all the way through and affect their social relationships as they grow up and later on. It's not fair to them that happens, but it does happen. And so it's an important thing to think about as well. And then anxiety can be a biggie, right, for impacting social relationships, not being scared to try something new, not being as comfortable in social settings. And so that just impacts their world if they're not able to engage in the social situations that they want to engage in. Okay, and then finally, like when you start to hear your child expressing their own distress about behavior. Why are there all these firecrackers in my head? Or why do I always have to be the one to get in trouble for running around? Or why am I, why can't I go to the party but I feel too nervous? Or, those types of things can be things. And so if you're hearing them express it, then it's another time to think about, okay, this is causing them impairment. They're recognizing it. And so let's see what we can do to help. Okay, so then those are kind of the top 5. Any questions or anything about those? And we'll kind of come back to some of the ways to think about these things again too. Okay, so then the next thing is considerations for starting treatments. For any treatment, for anything, the idea is that you're weighing your risks and benefits against each other to make sure that the balance is enough that the benefits are much higher than the risks or the side effects, right? And so that's a important thing to think about. The way I like to think about it is really kind of in these 4 squares. And so, what are the benefits of taking the medication versus not taking a medication? Versus what are the risks of taking the medication versus not taking it. And so for any child and any situation, then this is what you do. And this applies to adults too. So whatever, I know some people may be parents of older kids or adults, and so just know that I'm a pediatrician, but I had a 68-year-old patient today with Fragile X. So I work with the whole lifespan. Because when you have a rare genetic disease, there's not always an adult equivalent of me later on. So I just see them till they're really old. Okay, so if you guys could think about, is there anyone who can think about if we start over here? Well, oh man, hold on, let's go back. What would be some of benefits of taking the medication? Like just shout out 1 or 2 little things. Okay, so decreased anxiety or decreased symptoms, right? It's working for what you're trying to get it to work for. Focus, improving attention span, right? So improving the symptoms, right? So those are, the behavior might improve. That's the biggest hope, right? That's the reason we're doing it. Overall functioning may improve across different settings, social environments, attention, anxiety, feeling that you're doing what you can do to help your child with the situation. Some of the risks then, side effects, right? You guys brought this up already. We're worried about what the side effects may be from changing their personality or, doing something that way to weight gain or other types of medical side effects. Obviously a risk is the medication may not work, right? What if it worsens behavior or makes them more irritable as a side effect? And then some parents feel guilty, like, I feel like I'm not doing enough. I'm just giving a medication to help them, keep them quiet or whatever. And for that, I really think of, okay, well, if that's the only goal is like, oh, I want to watch the football game, here, take this pill, right? That's not okay. But if it's like, oh, wow, he is quieter and more able to regulate himself in the school setting, then that's a benefit of the medication. And so you have to, different people feel differently about medications. And some of it is this kind of stigma of mental health medications that still exists, in our country, and especially for kids. And so, I think that some of that is, also just like, okay, if it's really helping, then it is beneficial. And as long as you're doing it along with, all those other parts of the treatment to really help them learn other skills and strategies as well. Obviously, risks are costs and appointments. If there's any kind of medical monitoring, sometimes lab draws can be really hard and distressing. And so, thinking about those types of things as well. And then what are some benefits of not taking a medication? Cost, yeah, like just the hassle of what it's all about, right? Maybe insurance doesn't provide it, you're avoiding the side effects, you're avoiding the cost. You can find maybe other treatments that might be helpful that aren't medication treatments, and then you can always consider them later. So, that's sometimes where we come to when families come in for an appointment is like, okay, we're not ready yet, we're not quite there. Let's work on some of these behavior strategies or therapies first, and then we know that's an option for later on. And then risks of not taking the medication, right? The behavior can continue to escalate and cause the same, whatever problems it is that it's causing, the behavior may get worse. And then really what we're trying to do is not have it limit opportunities or learning or other things. And we don't want, those other challenges to continue to escalate. Okay, so that's the framework I use, and that's what everybody can think about in terms of if this is something you're considering for any kids. And also I use it just in the context of thinking about changes in dosages. I guess I should have asked here, like in this audience, like who has kids who are less than 5? And who has kids who are like 6 to 12? And who has kids who are like over 12? And any parents of adults? Okay, so there's really a big spectrum. And then how many of your kids are already on meds for behavior? So you've gone through this process before, but this is what I use also for dose changes and adjustments and starting another one, right? Like we're already on one, we're going to start another. Okay, so then thinking of starting medications, there's this kind of like continuum, right? Of like, oh, the symptom is present, it's causing a little bit of problem, it's causing a lot of problem, it's causing a crisis, right? He's getting kicked out of school, we're failing school, you know, where along the line should medications be started? And, you know, there's not a right answer to any of this. It probably isn't like the top, right? Like symptoms are there. But it's, you know, as I've practiced for longer and longer, I have become more aggressive, I don't want to say aggressive, but more comfortable starting medications earlier on, especially in genetic conditions where you know, this is not necessarily something they're going to get over, right? We know there's true genetic differences in brain development and that neurotransmitter systems and you know, brain connectivity is different. And so if this medication is helpful to help stabilize some of that, then, you know, the medication is replacing or helping with some of the differences in that neural functioning. And so, you know, I'm more comfortable recommending them at younger ages if I know that's the progression and before they're causing significant problems. Clearly, if they're causing crisis, right, we need to start. But, you know, I'm kind of getting, as I get older, I'm getting, you know, going up the ladder. Okay. And then this is what I just said, like medications as the last option, I kind of caution families against. If, you know, you don't want to be like, oh, we are kicked out of school, right? Or now we're on our third preschool, because that's just a lot of stress, not just on you, but on your kids as well, related to, you know, having repeated failures and having high levels of anxiety is not good for brain development either, right? And so you just want to, you know, I think not wait until it's the very last option. And some people may be more comfortable at different places along the way. Okay, so the other thing that's really important is you have to, you know, especially in some kids who may have less ability to communicate, we have to make sure that we're not interpreting a behavior as a behavioral difficulty when it's really due to a medical difficulty, right? And so it's always important to think about with your providers, okay, are there any other potential medical causes that could be contributing to this behavior? You know, you want to rule out any kind of pain, ear infections, dental problems, things in those kids who may not be able to communicate that as well. You know, that those are not present and causing them to be more irritable or agitated. Constipation and GI symptoms can be, you know, another trigger for a lot of behaviors, headaches, vision and hearing problems, seizures, thyroid problems, sleep apnea. So you want to think through all of the different medical conditions that could be there to make sure that they're evaluated sufficiently before you're starting a behavioral medication for them. The other thing is kind of thinking about these environmental causes, right? Oh, his attention is horrible in math class and the teacher thinks he has ADHD. Well, if it's only math class, but they're not, the other teachers are not necessarily seeing those concerns, well, then maybe that setting, that environment is just not the right environment. It doesn't mean the behavior is really the problem, right? It means that the setting is the problem. So always thinking about the context of, you know, where you see behaviors happening. Now, it's really common to have, oh, he does great at school and holds it together all day and then is horrible at home. That doesn't mean that, you know, home is the problem necessarily, but it can mean that, you know, she's been holding it together all day at school, but it really is having a lot of challenges such that it all comes out when she gets home. So, you know, so I think that, you know, there are still some times where it doesn't have to be severe across all settings that you would still think about medications. Okay, so you've made a decision to try it, and then now what do you do? Well, I think the big thing is identifying target behaviors, right? So for you to monitor response to a medication, you have to know exactly what target behavior you're actually treating to choose the right medication. And then what would you like to see improve? So the idea is really answering the question, kind of what is the core symptom? What's the core problem? And then how can we then, use medications to target that and then monitor response? And so here again are all those different behaviors we might be targeting, right? We may be trying to, and the ones where, there are not medications that lead to improvements in, cognitive functioning. So most of those ones over on the left-hand side are not things that we're treating with medication. There are more things over here on the right that are the medication targets. Okay, so we're going to use an example. This is Albert. He's a 7-year-old boy, and the complaint in clinic is that his behavior is getting worse. The school keeps calling me because of his behavior. We're going to the grocery store, a restaurant with him, and it's horrible because we can't go anymore. He almost got hit by a car yesterday in the parking lot. We got kicked out of speech therapy. Dr. T, we need help. Okay, and so this to me is like, oh, okay, that sounds like things are pretty bad. But this isn't really that helpful as a description because we need more information. So, what are the considerations here? There's definitely sounds like there's safety considerations, right? There's academics and therapy being affected. There's family and community functioning being affected. So we're checking off a lot of those 5 reasons. And so, what are we going to do next in terms of thinking about this? Well, the school keeps calling me because of his behavior. So we're going to look into this a little bit more. So what does that mean? Does it mean, okay, well, he can't sit through group activities or circle time. The teachers always need to redirect him to his work. He gets out of his seat. He, grabs belongings of other students. That's a different story than, he has meltdowns every time he transmissions and he gets stuck. He's overwhelmed in the classroom. He doesn't want to do something. He walks out of the room. He becomes disruptive with peers. So those are kind of different stories. And they kind of represent different kids, right? So this guy up here is like, he's we're targeting more this kid who's more hyperactive and impulsive, and that's the core symptom, or that's the core problem, as opposed to kid number 2, who sounds like it's more either sensory overload or anxiety or other things that you would be targeting. And so our medication choices for this would be different. Going to the grocery store or the restaurant is horrible. The first guy is, he can't sit still. He's hyperactive. He grabs and touches everything. He yells when he can't get something he wants. Like he's really kind of all over the place compared to he's really overwhelmed in the busy place. He doesn't like new places. There's changes in routine. He asks over and over when we're going home. So those things are indicating more symptoms of anxiety. He got hit by a car in the parking lot, or he almost did. Well, he ran off when he saw the ice cream store he wanted to go to, is more impulsivity compared to he did not want to go to the dentist. That behavior is more avoidance, right, of something he doesn't want to do or he's anxious about. He got kicked out of speech therapy, and then the example is the same. Why did he get kicked out? His attention span isn't long enough, like we talked about before, to actually, the therapist doesn't do they're feeling like they're doing anything to help, compared to someone more anxious who's maybe agitated in the room. She talks loudly, the sensory pieces can be pretty big. He's frustrated and overwhelmed pretty quickly because it's really hard for him, and speech therapy is more challenging. So there's more anxiety. So do you guys see the differences in these, and can you kind of see some of your kids in these? Who has kid number 1? Who has kid number 2? Okay. Yeah, I guess. Who has both? It's totally possible, and it gets trickier, right? Because then you're sitting there saying, okay, well, and so when you have both, it is then, okay, let's try and find what's which one seems to be more significant. Sometimes it's which one seems to be more significant, or sometimes it's, well, ADHD is kind of easier to treat in some ways than anxiety, depending on like just the medication trials and stuff like that. So sometimes it's like, well, this will be easier to kind of sort things out if we start with these symptoms. But usually you find the primary symptom that seems to be causing the most struggle and then treat that and see how everything else shakes out, right? Because if you're anxious, all of us know, you're anxious, you're not paying attention as well as you should. You're not paying attention, you miss that thing, and you're anxious, then you're going to be more anxious and you're going to be less paying attention. Like, there's a cycle to a lot of these behaviors that they feed off of each other, and it's hard to sort out a lot of times which one is which. So, okay. So then we've identified a target behavior. Like, let's say we've identified, ADHD symptoms up here. The medication consideration would be an ADHD medication. And then how are we going to monitor the response to medications? I do this thing, and I'll show you on the next page. But basically, I feel like if I'm going to prescribe it and you're going to give it, the next question that parents ask is like, well, how am I going to know if it's working, right? How do I know if this is good? Well, I think you should be able to tell that there is something better, that whatever that, it may not make things 100% better, but you should feel like that level of impairment is decreasing. And so finding and thinking about pretty specific things that behavior change or improvement would do for your child is the way that I think is the most helpful to track it. Right? So what is his or her, actual attention span in a work setting? If it's going from 1 minute and 2 minutes currently to 6 minutes, well, that seems like a good change. If it's going from, 1 minute to 1 minute and 4.4 seconds, I don't know that that's a significant enough change that I'd want to keep prescribing that. So you want to, or we need a dose adjustment or something like that. So we want to think about things that are, very practical for what is happening and the impairment that's being caused in your day-to-day life. The same thing for anxiety, right? What are some things that would be things that we'd want to monitor specific to your child's anxiety? Decreased, better able to tolerate transitions, decreased vocalizations if that's what they do when they're overwhelmed, more flexible with changes, more willing to engage in social conversations. Like whatever it is those things are that the anxiety is causing, then those are the things, we're going to come up with as a team. And so you want to think about how frequently it happens, because you can put that in your goal. The duration of a meltdown, you can put that in your goal. The intensity of reactions, well, they happen just the same frequency, but they're really a lot milder than they used to be, so transitioning out of those situations is easier. And so there's kind of formal ways to track things, and then there's more informal ways to track things. And I don't know, some doctors are very into the formal standardized questionnaires that they make you fill out at every visit. And we do that too, but we don't make you fill it out necessarily all the time, because I feel like a change in a score on a questionnaire is less meaningful to me than you telling me, oh yeah, he's way better. But sometimes those questionnaires are great for getting information from teachers, right, and other people, for looking at big trends of things like, oh yeah, everyone's kind of seeing that this seems to go down, or everyone's kind of seeing that anxiety is going up, so that we can look at, some of those scores a little bit more. But I don't think they're not going to make me make a medication dose adjustment if you can't tell me the direction of change that you're seeing. So this is what we do, or what I do, is I come up with the treatment plan, and it depends on the kid, but kids who are, old enough to know and understand their behaviors and have the level of functioning that they can understand what's going on, is I really involve them also in the whole process. So, I had a 12-year-old the other day. She was coming in for a lot of challenges with attention at school, and was recognizing that, she was just not doing well in terms of staying focused and was getting in trouble a lot. So I always make the team, right? The team captain is the kid. The team members are who's going to help us figure out if this medication is helping you. You're the team captain. You're going to tell us what you think, but we need some team members. And so team members are usually parents, teachers, therapists, coaches, people, siblings sometimes are in the room. I want to be on the team. And so, we figure out who are those people. And then we make the specific goals, right? What are the goals going to be? How are you going to know if it's helping? I'm only going to get, in trouble 2 times a week at school instead of 25. Or, we're going to be, so some things that the kid knows that they can track. And then parents kind of have an idea of, oh, it only takes us, 20 minutes to get out of the house instead of 45 minutes. Or something that would be a tangible, like something that you can really, put your finger on if it's actually changing, that are specific to your child. Okay, and then monitoring the response to treatment, I kind of talked about this. Standardized tools and questionnaires, like for ADHD symptoms, completed by other people, and we talked about kind of, I think there's strengths and some limitations of using these as well. This is one how many of you guys have filled these out like 1,000 times? Yeah, so, okay. Other ways, there's definitely behavior logs. If people have behavior therapists, or sometimes schools monitor behavior very carefully with all these logs or notebooks they send home to you every day. And it can be helpful. I am not one who really believes in you should hear every single negative thing your kid does all day long, because that is not something that I think is very productive. And so, I do think there are some aspects of really closely tracking behavior and, checking off all the bad things without checking off the good, I don't think is very productive for anyone. But, sometimes it's helpful to track over a course of time. Oh yeah, look, there are way more green days than there were orange days or yellow days, just to get a general information about how things are going. And then obviously you need to know details of things that would be related to injuries or accidents or things that are kind of big deals, right? And then also looking at therapy reports and other things to kind of help, come along in terms of some other logs and ways to follow how medications are changing. Okay, so finding a doctor. It sounds like a lot of you guys are on meds. Is there anyone not on meds? Okay. And so a lot of times the next question is, well, how do I find someone, right? No one knows about WSS. What are we gonna, who's gonna help me with this? And so your primary care doctor can probably prescribe medications. Most pediatricians are pretty comfortable with ADHD meds. Your primary care doctor can also refer you to a developmental pediatrician. That's what I do. A child psychiatrist also prescribes meds for kids. Developmental neurology in some places is available and prescribes medications. And then if they don't have it, I think sometimes the best people are just referrals from your local groups. There's not going to be a ton of WSS patients in every region, right? That's oh yeah, this is the doctor for that. So I feel like finding doctors who work with kids with autism, which is a lot more common, is, whether or not your child has autism or autism symptoms, they are used to working with complex kids who have all different levels of behavior. So you're going to want to, find that doctor to work with, probably, above someone who's the adolescent specialist in, teen depression, right? Which is maybe not is a different kind of setting of the types of challenges. Not that you don't need them if there's depression, but there's just kind of different specialists of different people. Okay, so then who can't prescribe medications? Your psychologist can't. Your teachers can't, right? So there are some times where parents come in and my teacher thinks he needs meds. Well, let's look at the whole picture. They may be right, but there may also be, better environment or more supports that they need in school before we do medications. And then, therapists obviously can't either. So, but they're also all really helpful as part of this team idea, right? So, recognizing and letting them know about medication changes so they can tell you too what's happening at school is important. There's different styles of doctors. Some are very authoritative and say, this is what you're supposed to do. And some are more collaborative. And so, you have to figure out which kind of doctor you like. Some patients really like, collaborating and talking through things. Other patients are would you just tell me what to do? I don't know. I want you to tell me. And so, there's different types of patients too. So you have to figure out what type of relationship or level of engagement in that way is best for you, because these medications take a lot of conversation, right? It's not oh yeah, your blood pressure is higher, right? You have to, do a lot of back and forth to figure out what's going on. Help your doctor, though, be a good doctor, right? Come in with the appointment, ideas of what the treatment goals are, specific examples of what the difficult behaviors are, what happened before it, what happened after, how you're responding to behaviors. Like knowing all that information is really helpful for making decisions related to medications and other therapies and supports. Write down your questions if you're one who's not going to remember them, so you can be like, oh yeah, I have these, couple of questions. The list of like 17 questions in the 20-minute appointment is a little bit hard. And anything else you have from other evaluations, from psychologists, from treatment goals and progress toward goals from therapists and other things can be really helpful to look at too. When we start medications, we usually start low doses, go up slowly, one change at a time, right? We're not going to start 3 medications at the same time because we'll have no idea what they're all doing. And so usually, with some medications we start, I like to check in a couple weeks sooner if there's concerns, see how things are going, and then we kind of go from there whether or not we're going to go up on doses or change things. It's always really hard. Some parents are like, oh yeah, we're going on Christmas break and I want to start meds now while he's on break. And you just have to think about your child and how they behave differently on breaks, right? If Christmas break makes them really dysregulated, then it's going to be really hard to know, well, is it the idea of the transition to break or not? So actually right now at school is a great time, right? They're settled into school. Their teachers know them now, it's a good time before all the crazy holiday stuff starts to start thinking about trying them. But these big transition times are usually not the greatest time if your child has challenges with those settings. I do usually say start on a Sunday or on a Saturday, right? You don't want to be like, okay, here's a new medicine for your attention span. See you after school. Let me know how it goes, right? So you want to be able to see what the meds do. Especially when you're starting something new or dose, adjusting a dose. Okay, and then these are all the common questions to ask. What are side effects? What are rare side effects we watch for? If they happen, what should we do? Who do I contact if I'm concerned about them during the day, at night, when you're after hours? Do we need to take it every day? What if we forget it and we go on a trip? Is this something that's dangerous or not? Because different medications are different. If he misses a dose in the morning, should I give it to him after school or should I not? And there's a lot of different answers depending on which meds. And then follow-up visits just depend on your doctor and the frequencies but that's we're not going to talk too much about that. Okay, so all the different types of medication. What time is it? Okay, cool. So I'm going to go through these very quickly. I'm not going to spend a lot of time talking about each specific medication because that talk could go on for hours. We'll talk about some general classes, and then I'd love to take some questions too. But basically, when we're talking about ADHD symptoms, the ADHD medications fall into 2 big categories, the stimulant medications and the non-stimulants. And then anxiety medications, most commonly the SSRI medications are used, which are the serotonin-specific reuptake inhibitors. Serotonin dysregulation in the brain is highly connected with anxiety and depression, and so serotonin medications that boost serotonin activity are really helpful for medication or for anxiety symptoms. Irritability, aggression, self-injury types of behaviors, you can use SSRIs as well, but also atypical antipsychotics is another class that's used, or mood stabilizers, and then OCD types of behaviors most of the time is also SSRI medications. This is medications for ADHD. The most common ones, methylphenidate, you guys have all heard of Ritalin, and that I think came with a big stigma from the 80s and early 90s where everyone thought, oh, it's being used way too much, and then the pendulum kind of swung, and but actually the stimulants are very effective for ADHD symptoms for most individuals. And kind of the first line medication for ADHD. And then non-stimulants can be great as well. I use a lot of guanfacine or Intuniv, which can be really helpful for attentional difficulties and anxiety as well sometimes, and some of the other ones on here that are the non-stimulants. Then when they take stimulants, they look like this, which is not really usually true. for anyone. And then there's medications for anxiety, right? And so this is a cartoon, a little guy, couldn't help it, my lack of serotonin made me do it. And so, like I said before, serotonin is really one of the key neurotransmitters related to anxiety. And so some of the examples of the SSRI medications are things like, you may have heard of citalopram or Celexa, Lexapro, sertraline or Zoloft, and Prozac, and these are, all FDA approved for use in kids with anxiety and different other conditions as well. Okay. There's a lot of potential benefits. Basically, decreasing anxiety is the whole goal, and whatever other behaviors go along with anxiety, and a lot of irritability as well. And so there's a lot of things that you have to think about exactly what is the anxiety causing. Is it social anxiety? Is it generalized anxiety about everything? Are there certain phobias or other things? So there's a lot of different evaluation related to anxiety that you would think about with SSRIs. And then there can be side effects too. The main one that I would say is limiting is sometimes that it causes them to be more irritable or more agitated. And so you certainly don't want to be treating irritability with a medication that causes irritability. And you don't want to be treating anxiety with a medication that causes irritability. So, but that would be the most common reason that we usually end up changing it. And then there's a lot of other medication treatments as well. Atypical antipsychotics are FDA approved for irritability and aggressive behaviors in kids with autism and other disabilities. And it is a class of medications that we use frequently when behaviors are more challenging or when there's injury and aggressive self-injury as well. And then other mood stabilizers as well if the atypical antipsychotics aren't helpful. Okay, so that's just a basic general overview, and I'm happy to answer any questions if people have any. Yes.
I know you were waiting for it. So I just wanted to hear your thoughts on the pharmacogenetic testing or the pharmacogenomic testing and how you feel about it, because we're trying to get it, but our doctors are like, it doesn't do any good. So.
Well, I don't know. We've been using it. I use it sometimes. I used it a lot when it first came out because I'm like, well, let me see if this is going to change how I practice and everything else. And I'll tell you that, it led to me changing medications more often. And sometimes having fewer side effects. I don't usually use it for my first line treatment unless a family is like really cautious about, wanting to know everything they can know beforehand. So for those of you who don't know, pharmacogenomic testing or pharmacogenetic testing is testing, it's a genetic test that looks at primarily two things. One is the little differences in the genetic code of different mostly neurotransmitter receptors, or the receptors that the drugs bind to. And so sometimes a little bit of an alteration in the code can mean that a drug binds to it more strongly or less strongly, and then alters the signaling that happens after that. Sometimes leading to, higher rate of side effects, sometimes leading to, you don't need quite as much of that medication to get the same effect. So there's a bunch of, research looking at whether or not these differences in the genetic code of the receptors are different. The other thing it does is it looks at the genetic code of the enzymes that metabolize the drug. So if you're like a fast metabolizer of a drug, you're going to take it, and then your drug is going to be broken down really quickly, and so you may need a higher dose. The other way around, if you're a slow metabolizer, because of the differences in that enzyme, you may need a lower dose because the drug is going to stick around for a little bit longer. And so there's a lot of information, and so what the companies do is they say, okay, based on your profile, these drugs are green light drugs, meaning that, you should be good to take them. These ones are yellow light, like caution drugs. You may need a higher dose, lower dose. There's mild kind of, considerations. And then these are red light drugs, meaning, your genes don't match what the medication effect is supposed to be. There's going to be more side effects or other things. There are some true medication, like contraindications to some medications that like if you have, this genetic mutation and you're on Lamictal, you're much more likely to get a, life-threatening rash or something. Those are important ones. They're not ones we use commonly, but, there are some that are really important. So I don't use it at the beginning. If we're having a hard time finding a medication, there's a lot of side effects or other things, I will order it to see if, is there something different about the metabolism, especially of these kids, that we're gonna need a lot higher of a dose or we're gonna need a lot lower of a dose. And then, if it comes back, sometimes it comes back and everything is green. It's not very helpful at all. Sometimes it comes back and, there's a lot of yellows or even some reds, but they've been on the red drug for 20 years and they're doing great on it. Right? And so I'm not going to change a medication like that as long as it's not like a medical side effect, right? If it just says, we really don't think this is going to work, but it's working, then you kind of have to take some of the results with a grain of salt. So it's still pretty controversial in terms of like how much evidence is there really, but I think the evidence is improving as we get more and more evidence in terms of more and more studies, and so kind of. Yeah, I use it, but it's certainly not the Bible, and I don't change something if it's working